Welcome to Health Champ, your source of a wide range of health tips and hacks. A stroke, much like a heart attack, is a brain attack. It happens when blood supply to the brain is blocked, or when a blood vessel in the brain bursts. When any part of the brain doesn't get its supply of blood, the brain gets damaged. Because the brain controls what all the other parts of the body do, a stroke can result in long-term disability. In the worst of cases, a stroke can be fatal and lead to death. According to strokecenter.org, each year, approximately 795,000 people suffer a stroke. About 600,000 of these are first attacks, and 185,000 are recurrent attacks. Nearly 3/4 of all strokes occur in people over the age of 65. The risk of having a stroke more than doubles each decade after the age of 55. In a report by the World Health Organization, stroke is among the leading causes of deaths in both the high-income and upper-middle-income countries. Globally, it is the second top cause of death. The elderly, and people suffering from high blood pressure, diabetes, and heart disease, are the ones with the highest risk of getting a stroke. Common types of stroke. There are two types of stroke. The first is ischemic stroke. This happens when blood vessels in the brain are blocked. Plaque, or fatty deposits, can build up in the blood vessels, causing blockages, and preventing blood to flow to the different parts of the brain. The second type is hemorrhagic stroke. This happens when a blood vessel pops, causing internal bleeding. As blood builds up, and blood supply is cut off, it damages the affected parts and connected tissues until the brain eventually dies. Signs and symptoms. A stroke is a very serious medical condition, and every minute counts. Application of quick treatment is essential to lessening the damage it can cause. Therefore, it is important to spot a stroke at the onset. Here are things to watch out for. Sudden numbness or weakness in the extremities, making walking or doing simple hand gestures extremely difficult. Often this happens to only one side of the body. Sudden numbness on the face. Sudden difficulty in communicating simple thoughts, trouble speaking, or difficulty understanding speech. Sudden impairing of eyesight. Sudden dizziness or lack of coordination. Sudden severe headache. If you notice any, or several, of these sudden signs, call the emergency hotline immediately, or bring the patient to the nearest hospital. Prevention. Prevention is better than cure, hands down, most especially for diseases like stroke. Here are 12 tips to prevent the dreaded medical condition. 1. Keep your blood pressure lower than 130/80. Monitor your BP. If it goes above 140/90, you have a high blood pressure and need to consult your doctor immediately. 2. Keep your cholesterol levels at no higher than 200 mg per deciliter. High cholesterol can lead to fatty deposits forming in, and blocking the blood vessels, in the brain. 3. Maintain a healthy diet. Refrain from eating fatty and high cholesterol foods. Include in your diet fresh fruits and vegetables, especially those high in fiber. Also, limit salt in your diet. 4. Maintain the right body mass index, or BMI. Lose those pounds, if you're above your recommended weight. Know the right weight for your age and height and maintain it. 5. Manage tips 1 to 4 with physical activity. Exercise will help you keep a healthy weight and lower your cholesterol and blood pressure levels. If you're only starting out, try 30 minutes of brisk walking at least 3 times a week. Consult your fitness coach when it's time for you to progress. 6. Diabetes can cause damage to blood vessels. If you are diabetic, maintain your blood sugar level to 120 mg per deciliter. The normal blood sugar level is no higher than 100 mg per deciliter. 7. Stop smoking. One stick has 10 to 20 mg of nicotine, which sticks and builds up on the linings of blood vessels. 8. Limit, or altogether stop, alcohol drinking. Alcohol intake increases the risk of stroke. 9. Do not use methamphetamine. It is illegal in the first place. Methamphetamine is a leading cause of stroke among younger patients. 10. Protect yourself from pollution. According to one research in Asia, polluted air environments is clearly linked to stroke cases. 11. Avoid hot environments and climates. According to doctors and medical researchers, there is a significant increase in stroke patients when the weather is hot, or in countries with a hot climate. Avoid staying for long under the sun between 10 a.m. and 4 p.m. 12. Avoid stress. Stress forces the heart to work harder. When that happens, blood pressure increases. At the same time, it increases sugar and fat levels in the blood. When these things occur, it can lead to an increase in the risk of clots forming in the blood vessels that can cause a stroke. Free yourself from stress. Thanks for watching. If you learned something new, please hit the like button below. For more health tips, tap or click the subscribe button. While you're at it, ring the bell button to get notified when we post new videos.